I'm Adrienne Arsenault. Andrew is away. Tonight, U.S. health authorities hit the brakes on the Johnson & Johnson vaccine amid concern over blood clots.
You want to make sure that safety is the important issue here.
What happens now and the impact on the vaccine rollout here?
Health Canada will, every step of the way, put the health of Canadians first.
So now it's blood clot concerns about 2 vaccines. We ask a doctor about the actual risk level. And some Yazidi women face an impossible choice in northeastern Syria. Return home, but without their children born of rape by ISIS fighters. Their stories and determination to stay together. The final curtain for CBC hit series Kim's Convenience, an ending that left many frustrated.
We didn't get a chance to say goodbye. When it's suddenly yanked away from you, it's very jarring and it's hurtful.
One of the stars addresses the key question, what happened? This is The National. 4 months into the rollout, frustration is growing as Canada falls far behind the United States in vaccinations and then, even worse, passes it in case rates. Today, another problem. The U.S. has frozen its use of Johnson & Johnson's single-dose vaccine over cases of rare blood clotting. One of them fatal, all in women who'd recently had the shot. With 10 million doses on order, Ottawa is watching the situation very closely while Canadians absorb this latest twist in the vaccination saga. The Johnson & Johnson vaccine is a big part of the COVID-19 strategy on both sides of the border. As a one-and-done treatment, it is meant to really speed things up. But for now, it's on hold. Here's Katie Simpson with what we know so far.
Lineups at vaccine clinics across the U.S. remain steady as frontline medical staff had to make a last-minute change, swapping out the Johnson & Johnson vaccine after federal health authorities hit the pause button.
You want to make sure that safety is the important issue here.
The U.S. has administered 6.8 million doses of Johnson & Johnson. Out of that, 6 women between the ages of 18 and 48 developed a rare but severe blood clot, all within 2 weeks of getting the shot. 1 woman died. A second is in critical condition.
This is a really rare event. If you look at what we know so far, there have been 6 out of the 6.85 million doses, which is less than 1 in a million.
Scientists will now study the 6 cases and determine a course of action. The White House says the setback will not knock it off its vaccination targets.
So there's enough vaccine that is basically 100% unquestionable for every single solitary American.
Canada has approved the 1-dose J&J vaccine, with its first shots expected to arrive later this month.
Obviously, we're following closely developments in the United States, and we can assure everyone that Health Canada will, every step of the way, put the health of Canadians first and foremost.
The J&J pause has some Americans worried it will fuel vaccine hesitancy in what so far has been a fairly consistent rollout.
I have friends who said that they would only get the Pfizer vaccine, like no other vaccine. So if they weren't given a choice to get the Pfizer vaccine, they wouldn't get a vaccine. So I am definitely worried.
Public health leaders are aware of those fears and hit the airwaves with the same message that any risk here is extremely low.
When you think about a 1 in a million event, that's, you cross the street every day, you have a much higher chance of getting run over by a car.
So, Katie, how long could this pause last?
The Centers for Disease Control says it could be a few days, but it's all going to depend on what they find out. Even though the Biden administration says this is not going to have an impact on their vaccination targets, Canada will be watching this very closely. The U.S. says it doesn't want to loan more of its vaccine until every single person here in the United States gets a vaccine that wants one. And the sooner the United States takes care of itself, the sooner it might be willing to share with its neighbor in need. Adrienne.
All right, Katie, we'll be watching. Thank you.
Thanks.
Now, all this comes after weeks of concern about blood clotting issues with the AstraZeneca vaccine overseas. Today, Canada recorded its first case. Health Canada says a woman in Quebec experienced rare blood clots after receiving the AstraZeneca shot. Her name and age have not been released, but health officials say she did receive treatment and is doing well at home. So far, more than 700,000 AstraZeneca doses have been given out across Canada with no other clotting issues reported. So let's talk some more about this. Joining us now, Dr. Susy Hota, an infectious diseases specialist with the University Health Network. So Dr. Hota, can you put the actual risk of blood clots from the J&J and the AstraZeneca vaccines into some perspective for us?
Sure. So with the AstraZeneca vaccine, our understanding is this particular type of blood clot that's associated with a low platelet count happens anywhere from 1 in 100,000 people to 1 in a million people who've received the vaccine. With J&J in the U.S. so far, what we're seeing is less than 1 in a million seem to have gotten this type of blood clot. Our understanding is in the general population, this kind of blood clot in the brain can happen at around 3 to 15 in a million. So not that far off. But the bottom line is these are all rare events. So we have to put it in perspective in terms of that itself. The numbers are quite low.
When the conversation about blood clots happens, very often you will hear women in particular say, if you're worried about blood clots, let's talk about the birth control pill.
Yeah, I mean, the birth control pill, about 0.3 to 1% of women who take it over 10 years will get some kind of blood clot. But this includes a variety of types of blood clots, not just this rare type that we're talking about that's associated with the vaccine. But, you know, the bottom line is we take all kinds of medications that have risks associated with them. And sometimes those risks happen in, you know, up to 10% of people or even more. And we do it because we think the benefit outweighs any risk associated with that. So I think that's a situation we're in right now with these vaccines. The benefit outweighs the risks.
All right, Dr. Hota, thank you very much.
Thank you.
Now, Canada simply can't afford to lose any steam in its vaccine rollout right now. The numbers tell the story of a country in the grips of a devastating third wave. Daily case counts up 33% nationally since last week, an average of more than 8,000 a day. And the number that's putting such a crushing strain on hospitals, patients in intensive care, 24% higher than it was just last week. In Ontario, the situation is even worse. It seems almost every day the province is breaking new records, pushing hospitals and healthcare workers to the brink. And as Katie Nicholson tells us, the province is considering all its options, including bringing in outside help.
Ontario's intensive care units pushed to the limit, and so are their staff.
I did a night shift 2 nights ago. It's probably the busiest shift of my entire medical career.
Lately, most of Dr. Brooks Failus's patients either caught COVID in their workplaces or from a family member who brought it home from their work. It's one of the reasons he wants the province to rethink what it considers essential work.
If you're making plastics or concrete or toys, or paper, are these things that we really need for the next 4 to 6 weeks while we have a completely out of control epidemic?
The numbers are clear. Something has to change. Today, Ontario hit new highs. Test positivity rates now at 10%. 1,822 people with COVID-19 in Ontario's hospitals, 626 in ICUs, 2/3 of them on ventilators.
This is going to sound like hyperbole, but it's Armageddon, actually, in the healthcare system. It is not normal for Children's Hospital, Hospital for Sick Children, CHIO, to be opening ICU beds for adults.
But that's exactly what's happening. Ottawa's pediatric ICU now making room for 5 adult COVID patients, and maybe more if needed.
This is serious. This wave is worse than any of the previous waves in terms of the number of people who are being infected and the number of people who need to be hospitalized.
The province admits it's even looking outside for help.
If there are available teams that would be able to come from particularly the Atlantic provinces, we are certainly looking at that as an option.
One of those provinces, Nova Scotia, says so far there's been no formal ask. So for now, amid a deepening healthcare crisis, Ontario is going it alone. Katie Nicholson, CBC News, Toronto.
Reinstating travel in the Atlantic bubble will be delayed for at least another 2 weeks. Officials had hoped to reform the bubble next week, which would have allowed travel between Atlantic provinces without the requirement to self-isolate. But after a meeting today, Atlantic premiers say they're now looking at May 3rd as a target date, saying a surge in COVID-19 cases and new variants is behind the decision. Around the world, Muslims are observing another Ramadan amid the COVID pandemic. This year's holy month still includes fasting, prayer, and reflection and community, but with some new challenges. Susanna Da Silva brings us that.
We all wrote things that we are grateful for.
New customs created during the first Muslim holy month restricted by the pandemic are back again.
My brother wrote that he doesn't have COVID-19 yet.
This Winnipeg family is even looking to recreate last year's homemade mosque in their spare room, with religious gatherings still restricted.
You eat before dawn and after sunset, and you have the whole day to kind of reflect and be nice to people.
The day ends with a special prayer service and a meal or iftar to break the day's fast. In Montreal, while limited gatherings are allowed during the day, there is now an 8 p.m. curfew.
It's going to be just at sunset time, so we're going to be blocked from that. We're going to be blocked from our prayer at sunset time and the prayer which is even later in the night.
Last year, Shaheen Ashraf, who lives alone, was able to welcome her daughter to eat, but not this year. And a virtual meal isn't too appealing.
And I said, no, thank you. I mean, the whole point is lost, The whole point is to share food, but how am I sharing through a computer?
Packed, lots of food, lots of people, families coming. We have.
Vancouver's oldest mosque will also look different, with no indoor gatherings allowed at all. While this year they're fielding new questions: do the vaccines meet religious, dietary, and fasting requirements?
It's something that is permitted, and if it's something for it to save your life, to help your life, it's important to go and do so.
The hope is that the vaccines will allow the feeling the faithful get after Ramadan.
You feel very accomplished.
To be shared together with the rest of the community next year. Susanna Da Silva, CBC News, Vancouver.
Students and faculty at Ontario's bilingual Laurentian University continue to protest steep budget cuts that have now killed dozens of programs. Today, the Prime Minister expressed concern but did not offer to intervene.
The federal government will be there to support, but it is a provincial jurisdiction, and therefore they need to figure out what the plan is.
Laurentian filed for creditor protection this week, but has struggled financially for years, a situation made worse by the pandemic, of course, and the loss of foreign students. Roughly 100 faculty members have now lost their jobs. A new independent report says Toronto police failed to properly investigate missing persons cases, including some linked to a serial killer, because of systemic discrimination against the communities involved. Ali Chiasson looks at the recommendations and the reaction.
The report is titled Missing and Missed, for those who went missing from marginalized communities and the missed leads that could have saved them.
My report is the account of what went wrong and an examination of how things can be done differently.
The 31-month review led to 151 recommendations for the police service, like letting community organizations take the lead in some cases, plus changes to hiring, more civilian oversight, and a commitment to transparency.
Many things became clear to me during my work. One was that many marginalized and vulnerable people deeply mistrust the police.
One of the biggest blows to public trust was this moment.
The evidence today tells us that there is not a serial killer.
When actually, at the time, Bruce MacArthur was a person of interest with ties to all 5 missing men from the village. Today, we learned now retired Police Chief Mark Saunders sat down with Epstein's team.
He had shortly come off sick leave.
And he said he hadn't been adequately briefed before speaking. Toronto's interim police chief committed to doing right by the report.
Many chapters were difficult to read and certainly humbling.
Epstein's review found that connections between the missing men were missed because of siloed investigations, and that officers had stereotypical misconceptions about the LGBTQ community that impeded their work.
Her findings of failures in how he conducted some missing persons investigations, particularly those in marginalized or vulnerable communities, are accepted, and the shortcomings she identified are inexcusable.
The report isn't closure, but for many it proves
the community was right.
And the timing is right.
This issue is one of so many that demonstrate the need for that broader conversation about public safety, how it's delivered, who's delivering it, and why.
Ali Chiasson, CBC News, Toronto.
The families of George Floyd and Daunte Wright both spoke out against injustice at the hands of police in the United States today, while the officer that shot Wright resigned. Susan Ormiston is watching all of that for us this evening.
Another shrine, another name. Daunte Wright joins a list of young, unarmed black men killed by police.
It's getting bad, man. It's happening frequently, too much.
The giant fist, just like the one at George Floyd's Square, a symbol of resistance.
I'm so sorry.
Sadness today, and anger now boiling over in Minneapolis from Wright's family, his aunt.
They murdered my nephew. She killed my nephew.
A 20-year-old, a young father, his family pouring out their collective anguish at a system. And an officer who mistakenly say police pulled her gun instead of her taser.
I watched that video like everybody else watched that video. That woman held that gun out in front of her for a long damn time.
That officer, Kim Potter, a 26-year veteran, suddenly resigned alongside the police chief.
After 26 years, you would think that you know what side your gun is on and what side your taser is on.
Attorney Ben Crump has another case, another family who today linked arms with the Floyds.
We will fight for justice for this family, just like we're fighting for our brother. Yeah.
With just days till arguments wrap up in the Derek Chauvin murder trial, defense began its case today. Defense leading their case today with a former officer and use of force expert who said Chauvin did not use deadly force.
I felt that Officer Chauvin's interactions with Mr. Floyd were following his training, following current practices in policing, and were objectively reasonable.
Tonight, a crowd resumed its protest outside the police station in Brooklyn Center, a suburban city on edge. One outstanding question: will the police officer here be criminally charged? The mayor is under pressure to announce that soon, especially with the jury expected to consider its verdict in the Derek Chauvin trial beginning next week. Susan Ormiston, CBC News, Washington.
The Trudeau Liberals are taking a second shot at a key part of their reconciliation promises. Bill C-15 would bring Canadian law into line with the United Nations Declaration on the Rights of Indigenous Peoples. Olivia Stefanovich shows us even some Indigenous critics are wary.
We want to go visit our territories.
Before the pandemic, conflicts over a natural gas pipeline paralyzed the country.
The RCMP is enforcing injunction.
Sparking a debate over Indigenous rights. The Liberal government is now trying to adjust its approach through Bill C-15, legislation that would implement the United Nations Declaration on the Rights of Indigenous Peoples through Canadian law. The bill contains clauses affirming the rights of Indigenous peoples to their language, culture, self-determination, and traditional lands. But it's the potential impact on resource development that is the most contentious.
When a First Nation says no to a project, does that mean it's dead?
Conservatives, who stalled similar legislation in the Senate before the last federal election, continue to raise concerns, mainly over the requirement to seek free, prior, and informed consent from Indigenous communities before developments can happen.
It leaves a lot of unanswered questions and potentially the courts to decide that definition.
Consent is not a veto over resource development.
Supporters of the bill say it upholds existing rights that haven't been respected.
The bill is meant to shift that, and that is something quite significant legally, and it's overdue.
But some Indigenous people say Canada's interpretation of the Declaration doesn't advance their sovereignty and lets the government keep the legal upper hand.
Bill C-15 is going to entrench all of that, the colonial status quo.
Half a dozen provinces have already asked the government to delay the bill, worried it could compromise natural resource projects. But the government is pushing ahead, noting the details will be ironed out over 3 years after it becomes law. Olivia Stefanovich, CBC News, Ottawa.
Galen Weston, a giant of Canadian business, has died from a lengthy illness at the age of 80. Said to be the country's third richest person, he epitomized high society. The family firm, established in the 19th century, is now one of the country's largest private employers with 200,000 workers. Loblaws and Weston Foods, just two of its iconic companies. Being part of a dynasty can make you a target. In 1983, Irish police foiled a plot to kidnap Galen Weston. Today, his son and successor said, "My father's greatest gift was inspiring those around him to achieve more than they thought possible." Tonight, Canadians are saying goodbye to a beloved sitcom, Kim's Convenience, a farewell many were not prepared for. The show was abruptly canceled last month. Despite the controversy, Jacqueline Hansen tells us those in the industry hope the show's legacy lives on.
You know, it's a long time now. Mrs. Kim and me come from Korea.
In tonight's finale, a moment to reminisce.
Good memory, like this.
About the family so many have watched, loved, and related to. From the original play
It's a new one, very good, from Korea.
to its global success on the small screen. And even though it was renewed for a 6th season, the show's producer says the creators wanted to move on early. So fans and those in the industry are saying a reluctant goodbye to the show that opened minds and doors.
Growing up, for the longest time, I never had the possibility of even recognizing that I could even be within this industry, right?
The driving force of Kim's was co-creator Ins Choi, a Korean-Canadian himself who based the story off his own life. For budding director Justin Wu, Choi's success was an inspiration and the show an opportunity. Wu made his debut as a director in episode 5 of the final season.
I actually cold called and I made a plea to meet with the showrunners just for 15 minutes to make my case and show my love of the material. And why it means so much to me.
The lead character.
But Choi is said to have often been the only writer of Asian heritage in the room. In light of his departure, CBC said in a statement today that as the original playwright and a showrunner, Ins brought an authenticity that the producers ultimately felt could not be replaced.
There's so many.
This Toronto-based screenwriter hopes Kim's legacy opens more doors for BIPOC creators.
More change needs to happen, and you can have a show that has the diverse writers, but then who is the cinematographer? Who is the director? Who is the producers on the show? So all of those things matter.
Okay, let's toast to pray.
For now, a send-off.
Thank you for family.
To a show that's both broken barriers and carried the weight of doing so.
Amen.
Amen.
Jacqueline Hansen, CBC News, Toronto.
Fans are not the only ones disappointed. Actors of Kim's Convenience were blindsided by its ending.
To have it end so unceremoniously was painful.
Paul Sun-Hyung Lee on the pain of the show's abrupt finale and the pride of what it accomplished. Plus, the plight of Yazidi women raped by their captors and now their children rejected by their community. And forget trying to hit the high note. The feat that landed one Canadian woman in the record books. We're back in 2. Welcome back. Canada is bringing in enhanced screening measures for those coming into the country from Brazil. Officials are worried about a rise in the more contagious variant first identified in that country. That variant is just part of what's fueled Brazil's staggering COVID-19 death toll. As Stephen D'Souza shows us, that country is now on track to eclipse the U.S. as the hardest hit country in the world.
In Brazil's largest city, they're adding 600 new graves a day, and there are plans to build a new crypt with 26,000 spaces, awaiting the seemingly endless flow of the dead from COVID-19. Last week, Brazil topped more than 4,000 daily deaths twice, each a new grim record. Scientists predict the country could pass the United States in total deaths by the summer, despite having 2/3 the population. Like elsewhere, doctors say the COVID patients they're seeing in this wave are younger and were healthier, victims to new variants running rampant.
In one shift, I did February in the ICU. Out of 10 patients I was taking care of,
all of them were in mechanical ventilation. 6 of those patients had less than 35 years of age.
Yet again, there are calls for a national lockdown, but Brazilian President Jair Bolsonaro continues to play down the threat. Last month, he told people to stop whining. This week, he said there would be no national lockdown. With hospitals at capacity, there are waiting lists for ICUs, a sign some experts say the country's healthcare system is collapsing.
If you have people in need of an ICU bed and the person cannot get one, that's collapse. And that's happening in, I would say, over half of the states in Brazil. So we are in a national collapse.
With dangerous variants like P1 spreading in other countries, he says the world can't ignore the dire situation in Brazil.
We are obviously a threat to ourselves because the virus is out of control and we break records every single day. But we are also a threat to global public health because we are pretty much a factory of variants.
Vaccines are the likely way out, but supply is limited. The WHO says they can't help right away. Their message to Brazil's leaders: public health measures work. Use them. Stephen D'Souza, CBC News, New York.
A bittersweet ending to one of CBC's most celebrated shows.
But most of all, thank you for family.
Kim's Convenience says goodbye, but its impact is everlasting.
This type of representation matters more so than ever.
Paul Sun-Hyung Lee on the show's sudden finale and the doors the show has opened for other Asian artists. Next. Welcome back. Tonight, we're all saying goodbye to the CBC hit show Kim's Convenience as it airs its last episode. The final curtain comes after 5 seasons, a year earlier than expected. An ending that's left many fans and even cast members confused and upset. Tonight, we have an interview with one of the show's stars, Paul Sun-Hyung Lee. He sat down with Andrew to talk about the show's last episode and its lasting impact.
To the world, he is Appa, the stubborn, blunt, but well-meaning immigrant dad just trying to make a life in Toronto, running Kim's Convenience. But what started as a fringe festival play with Paul Sun-Hyung Lee and Jin Yoon in the lead roles,
you just have to be nice.
I am nice.
Quickly became a much bigger deal.
That's a rule. That's how they're doing that. Yeah.
Season after season.
They're gender neutral.
Who? I only see one person.
After season.
When communities and people see themselves reflected up on the screens, it means they've moved from the margins into the forefront, and it gives them a voice.
But it all ended, suddenly and under a dark cloud. The co-creators leaving, the production company deciding it couldn't continue, and the cast members feeling blindsided, angry even. It's left the show's fans with one big question: why quit now? I sat down to chat with Paul Sun-Hyung Lee just hours before the last episode aired.
I don't even know where to start, to be honest with you, because this must be an awfully weird day for you.
It's been very surreal right from the get-go, not gonna lie.
How are you feeling?
I'm okay. I think it's funny because I think there are so many mixed emotions and so many things to unpack still. I mean, since it's been a few weeks now since the announcement that the show isn't continuing, and it's been a process. Like I akin it to grieving a death in the family, because you have these waves of emotions that overwhelm you at times, and you're upset at how it ended, but then you remember the good times and you want to build on that. And I want to take all the good from Kim's Convenience with me instead of just dwelling on how it ended.
Well, you talk about likening this to mourning a death, and you know, some deaths you see coming and some you don't. Did you have any inkling at all when you were filming the last episode of the season that it might be the last episode of the series?
No, not whatsoever. That was that's been the hardest thing, is feeling robbed of the chance of, like, even if we'd had some inkling maybe to just soak it in a little bit more, or to just appreciate it a little bit more.
Thank you, God, for everything you give to us. For food, for freedom, for business, but most of all, thank you for family.
So what happened, Paul? Like on this decision to cut the series short? I mean, I've heard a few different accounts. I mean, some that the co-creator, Ines Choi, was sort of simply burning out on this. But you have also said that you tried reaching out to him, and there was a time where he wasn't even returning your calls, which sort of left a lot of us wondering, so what actually was happening?
Yeah, I mean, like everything, it wasn't like a design plan to end the show, and there was no mustache twirling villain behind it. It was just, it's a complicated situation. I want to reach out to Ince and just find out, hey, you know, I didn't want to try to change his mind. He made his decision, but I kind of felt that I would have liked to have known, or I felt I garnered the trust, because after all this time spent together working on this project and championing it and championing him and everything, I just kind of thought that would have been, just for my own sake, I would have loved that, but he wouldn't return my calls.
So to this day, Paul, do you even have a full understanding of why it all kind of fell apart?
I don't know the whole story. I will be the first to admit that. I know a bunch of it. I know what I know. And that's from my perspective. Again, it's very complicated. You look at it from different perspectives. There's so many different factors that come into play with the cessation of this show. It wasn't an easy decision. I don't envy the producers at all. CBC was a great support.
I mean, I'm hearing what you're saying, but I still can't figure out why in my head, like, why there wasn't a way for this to continue, right? Private matters are going to stay private. I understand the departure of Ines Choi for whatever reason, but it seems like so many of the major players wanted this to keep going. So why couldn't it keep going?
Kim's was so unique because you had an all Asian cast. And if you don't have someone who's Asian, who's part of the producing team, the optics look terrible too. And we want that authenticity. We need that authenticity for the show.
Action!
Unfortunately, the industry the way it is, it's very difficult to find somebody of that caliber to step in and replace someone like Ines Choi.
The legacy of Kim's is absolutely jaw-dropping. You know, I could tell you what I see when I see the show, but I more want to know what you see when you see not just the show, but when you see a billboard with the Kim's family on it, right? When you see a Subway ad, when you see a TV commercial, what do you see?
I see my family. I see my peers. I see a community of people who haven't had a voice. It fills me with pride. It's overwhelming. It's overwhelming, and it just accents the fact that this type of representation matters more so than ever. The normalization of entire groups of people shouldn't be an issue in the 21st century. We're all human beings at the end of the day, and this politic of divisiveness, this scapegoating, this blaming of others is, in my mind, heartbreaking and so infuriatingly lazy. And I think we've developed this culture where it's okay to be like that. It's okay to be nasty, to punch down. And what we really need more and more is kindness.
When I see the show, that is exactly what strikes me every single episode, that this is a family of people that looks like you, that looks like me, and they are normal people. They are kind people. They are warm people. On the other hand, you know, you mentioned this too. I think of the pandemic. I think how I see people who look like you and people who look like me getting hurt. And I'm left wondering, like, what am I supposed to think here, right? Like, how many steps forward have we taken? How many steps backwards have we taken, you know?
Yeah, it's heartbreaking, again, and it's infuriating, and it's maddening, and it's bewildering. It's shocking. I mean, why? And it feels like it's just flaring up again, and I think it just goes to show that as forward-thinking as we think we've become as a society, there's really a lot more work to do.
I only have time for one more question, so I got to ask about what's next for Paul Sun-Hyung Lee? I mean, like, I'm looking behind you. I see stormtroopers. I see a lot of really cool stuff that I wish I could get a closer view of. What's next for you?
Well, we'll have you over once the pandemic is over. You know, I've got a lot of things on the go right now. I can't talk about some of it. Others I am able to talk about. I'm leaning into the whole geek culture. This is a part of me that I've carried for so long. And a lot of people are still really surprised about because they know me as Appa. In fact, tonight after the episode, I'm doing my first ever live stream and I'm inviting all the fans. And I've got some OG Kimbits fans from the very beginning, and they're going to be my guests because I think the fans have made the show.
Well, Paul, thank you. And I don't just mean that for this interview. I mean it generally. Thank you.
Thanks. Appreciate it.
And if you missed tonight's finale of Kim's Convenience, you can catch it on CBC Gem. In Iraq, Yazidi women are struggling with a very difficult choice. Returning to their community after being enslaved and raped by ISIS fighters means leaving their children behind. Their stories next. Welcome back. Some Yazidi women in Syria are facing an impossible choice. After being captured and raped by ISIS fighters, they're being allowed to return to their communities, but the children they were forced to bear are not. The CBC's Margaret Evans and her team traveled to northeastern Syria to bring us this exclusive story.
The sun casts long shadows in this corner of northeast Syria, despite the promise of spring. 2 Yazidi women caught here in an unhappy limbo. Captured by ISIS in 2014, they are now mothers to the children of men who raped them and helped in the slaughter of their people. 30-year-old Nadia, not her real name, was sold to a Syrian militant at a slave market in Raqqa. She saved her sister and nephew by saying they were her own children. Shireen, younger, is from Kojo, a ghost town in Iraq after ISIS killed most of its men and boys and took the women. She was given to an Iraqi. Getting pregnant, she says, made it less likely he'd sell her on. He was killed as the Islamic State crumbled, and she found herself in a vast detention camp for ISIS families. Despite being a victim, she hid from the family looking for her. Despite all these women have endured, the Yazidi community won't allow them home unless they abandon their children. Yazidi heartland in neighboring Iraq isn't far as the crow flies, a few hours and a border crossing. Last month, helped by an NGO, 9 Yazidi women returned to Syria to collect the children they'd been convinced to leave behind. It enraged Yazidi leaders. Lalish, in the mountains above Nineveh, is home to the holiest of Yazidi temples and to the ancient faith's spiritual council. Prince Harman is a spokesman. The problem is if they bring these children back under Iraqi law, they'll be considered Muslim, he says. I'll support providing them a place somewhere, but not in the community. Even if Iraq changed its laws, the Yazidi faith only recognizes people born to 2 Yazidi parents. And although elders were persuaded to welcome Yazidi women who've been raped home, says Prince Harman, they will not accept the children of ISIS militants. Mahmoud Rasho, he runs with his mother's help a kind of way station back in Syria for Yazidi women he's helped find and rescue, including Nadia and Shireen. Everybody knows it was a kind of genocide, he says, so it was a duty for me.
but he also sees the so-called ISIS children as potential bargaining chips in his quest. In other words, he believes he can trade them for people or information. And so the sanctuary offered by the Syrian garden with its long shadows could be short-lived, replaced by a trap. But as they sit, mothers and children burrowing into each other, Nadia and Shireen insist they won't be parted from their children, no matter how painful for their families or their faith. If they don't, they will look for their horizon elsewhere, far from home and the stigma it has attached to them. Margaret Evans, CBC News, northeastern Syria.
What a nightmare. Canada is under fire for how it measures its greenhouse gas. Is Canada underestimating its methane emissions? Plus. Okay, that's really strange. A Canadian woman hits the low, low note and sets a world record. Stay with us. An update today on the Ever Given, the ship that was stuck in the Suez Canal. Egypt has seized the vessel and billed the owners $1 billion. They say the compensation is for damage to the canal and for losses incurred by blocking the global trade route for nearly a week. Egypt is also refusing to let the crew disembark. The world is on a very tight deadline to cut global greenhouse gas emissions by 2030. And according to the United Nations, it is not going well. Yesterday, Canada delivered its latest emission numbers, and it shows our inventory for methane, one of the most damaging gases, has not budged in a year. Inayat Singh explains why that might be.
Dave Risk has spent a lot of time hunting down methane. The federal government says the potent greenhouse gas forms 13% of Canada's total emissions, but it may be even higher than that.
Scientists in Canada and abroad have known probably for 20 years, probably for a couple of decades, that emissions were underestimated.
Environment and Climate Change Canada relies on mathematical modeling from a few hundred oil and gas sites to calculate total methane emissions. But Risk and his team have been driving to thousands of sites in Western Canada, measuring methane at the source.
Based on 6,500 sites of measurement, we figure that the real number should be at least 50% higher than it is in the inventories.
That backs up another report just last year from the government's own scientists that suggests emissions were nearly twice those reported. Matthew Johnson is also measuring methane emissions. He's researching a new technology that can pinpoint methane leaks from a camera mounted on a plane. It can drill down to a level of detail that's unprecedented.
At 2-meter resolution, you can actually see within facilities and get a sense of where the methane is coming from, and that's actionable information.
Johnson says that the success of Canada's methane reduction plan depends on accurate measurements.
You can't reduce what you can't measure. We better be measuring how our progress is going, or we won't make it.
Just yesterday, in Canada's yearly submission to the UN about its carbon emissions, Ottawa acknowledged that improvements to methane estimates will be incorporated next year. Both Risk and Johnson hope their techniques will be used as Canada tries to make those measurements more accurate. Inayat Singh, CBC News, Toronto.
Next on the National, an all-time low. How those notes paved the way for this singer to enter the Guinness Book of World Records in our moment. Next. Okay, that note is known as C1, the lowest C note on a piano. And Joy Chapman, who is singing it, just set the new world record for the lowest vocal note sung by a female. So the BC singer smashed the previous record, and tonight her new low is our moment.
I had just been doing my scales, and I just said to my little niece, I wonder how normal that is. And then we started researching about me going off the end of the scale. And then she found the Guinness record, and she was like, Oh, at that time it was just a D2, and she's going, well, you start your singing scales way below that. As it happens, I told my mom before she passed that, I said, your daughter's going to be in the Guinness World Book of Records. It's very difficult because at the notes that I'm doing, it's difficult to even hear. I'm planning to break my own record. I know I can go a lot lower, so my highest achievement is by going the lowest.
So my first thought is, how many of you are trying that at home right now? The thing about Joy Chapman is that she can apparently sing every note on the piano from the lowest to the highest. That is national for April the 13th.